All right, I am so excited, so honored to have Dr. Amy Bantham here on the Move Happy Movement podcast. Thank you so much for being on the show today.
Erin, I'm so excited to be on, and I'm very excited to be a podcast guest instead of a podcast host. So I'll
Yes.
follow your lead.
Yes, yes, yes. So I always love to tell my audience, how I connect with such amazing people. You're my first doctor of public health. For those that don't know your story yet, we had connected through a mental health actually meeting. There's like 65 organizations represented, kind of organized by the John W. Brick Foundation. Lynne Brick did that connection, I think maybe through the mini breakout session we had, and just through, a couple of years of just consistently posting content and staying connected with their organization when they started this new mental health online meeting to build communities. That's how I met you, through that. So I'm super excited, super honored. For those that don't know who you are, haven't heard your story, why don't you share your origin story and what you're doing currently right now, and then what you're really excited about in your future?
Yeah, great. So I would say my past is very much rooted in the health and fitness industry.
Mm-hmm.
And I've been a group exercise instructor for 25 years. It was
Wow.
something that I did during my lunch hour when I was a management consultant.
Oh,
And in 2006, I found the Fitness Industry Trade Association and went to work with them. And it was a way for me to leverage my background in
mm-hmm.
public policy and health promotion. And so
Mm-hmm.
I stayed with them for 11 years.
Uh-huh.
And then I went to get my doctor of public health. And I did that because I wanted to do more to connect the health and fitness industry to
Mm-hmm.
healthcare. And so I wanted to be able to speak using public health principles.
Mm-hmm.
And the program that I enrolled in, the doctor of public health, is very much a practice-based degree. And so a lot of it was advanced public health knowledge, but a lot of it was also leadership training. And so training us to lead health organizations.
Mm-hmm.
And so when I finished, I launched my own organization.
Mm-hmm.
And I would say that's my present and my future,
Yes.
because my past is the health and fitness industry, and my future is very much connecting the health and fitness industry with healthcare.
Mm-hmm.
And my doctor of public health research was focused on physicians prescribing
Mm-hmm.
physical activity and referring patients to community-based health and fitness centers.
Mm-hmm.
And another piece of my doctoral field work was connecting healthcare to communities. So very much looking at non-medical determinants of health and ways to integrate healthcare systems with all the community partners working to improve people's health outcomes through, in some ways, connection to social services. So that's how I came about with the vision of connecting healthcare, health and fitness, and communities. And that is the vision for Move to Live More.
Love that. Love that. And the name Move to Live More is such a powerful name. How did that come about?
Yeah, I put a lot of thought into that. I really wanted to capture the connection between physical activity and longevity, but not
Yeah.
only length of life, but quality of life. And I
Yes.
know with your background and interest in the connection between physical activity and mental health,
Mm-hmm.
I think living longer better
Yep.
is really an important piece of that. There's also a final piece of it, which I haven't shared with too many people, but it's also a nod to my husband and my children, who are have the name Livermore. And so Live More was an honor of them as well.
Oh, I love that. I love that. Now, I can imagine, through your experience, leading and facilitating fitness classes on a lunch break, and then, doing your schooling while probably having a professional career simultaneously. What are some strategies you've learned in keeping a positive mindset when you're spinning lots of plates?
Oh, the eternal quest for work-life balance. And I did teach group exercise throughout most of my time.
Mm-hmm.
I had to take one summer off, and that was
Mm-hmm.
really challenging for
Mm-hmm.
me because, as you know, it's so critical to every aspect of my life, and being a group exercise instructor is so
Mm-hmm.
much a part of my identity.
Mm-hmm.
So I would make sure it was in my schedule
Mm-hmm.
so that I would go and teach, I would go and take classes. Now that I can't do that because of health and fitness center closures and scale
Mm-hmm.
backs, I'm
Mm-hmm.
really struggling because it's not in my calendar. I would actually write it down. So there would be accountability to myself.
Mm-hmm.
So I'm failing in the strategies that I committed to years ago that worked well for me. So I need to get back to that.
And thank you for your authenticity. You know, we're going through something in history that no one has ever gone through. So you had, 25 years of consistency. I think you can be easy on yourself in this time.
One thing that I started when the schools first closed and the health and fitness center closed, so my kids weren't being active, I wasn't being active. So I
Hmm.
actually started something that I called Dr. B's Activity Hour.
Ooh.
And so I would take my kids out and I would do socially distanced activities with
Hmm.
them, so they could practice that.
I
We were doing
love
it with
that.
my family, but wanting them to practice that. And then I actually captured those and released those on my website so other parents could be
Yes.
active with their kids.
I love it being that example. How old are your kids, if you don't mind me asking?
Sure. I have twins that are 8, who are
Ooh.
girls, and then I have a son who's 10.
Wow, busy, busy. Oh my
Yeah, and
goodness.
they're very active.
Hmm.
They definitely, there's something to be said for being a physical activity role model, whether
Yeah.
you're a parent, whether you're a physician counseling your
Hmm.
patients on physical activity. Being a role model is
Hmm.
very, we need to model the behavior that we want to see in others.
Yes, I love that. We need to model the behavior we want to see in others. That is such a beautiful line, and it's so true. Um, and you touched really on so we talked about mindset, which is one pillar of Move Happy. The next pillar is about community, and you touched on that with talking about your kids and sharing images online with other parents and families. What are some other things that you've learned along your journey to build community, and how has that helped your happiness level professionally?
Yeah, I would say a big mantra of mine is how health and fitness centers need to create community. So,
Mm-hmm.
create community within their four walls,
Mm-hmm.
but also create community outside. So, connecting
Yeah.
to schools, connecting to
Mm-hmm.
workplaces, connecting to local businesses, really being seen as part of that community. And
Mm-hmm.
we all create our own community. We crave community, and right now we don't have the community that we're used to, and that's why we're suffering from isolation and stress and anxiety.
Mm-hmm.
So I do think that the community creation
Mm-hmm.
component is key, and that's
Mm-hmm.
why communities is a big piece of my vision for Move to Live More,
Yeah.
because I didn't want to be about helping already fit people get fitter. I wanted to
Mm.
be more about enabling large scale change in the world and moving the dial on physical activity and
Mm-hmm.
really
Mm-hmm.
having much more of an impact. If we're going to have an impact on getting the world moving,
Mm-hmm.
we need to reach a much larger segment of the population. So I
Yeah.
was really drawn to organizations that are working on getting people physically active in places that they're already going. So churches, schools, libraries, other community-based recreational centers, and really
Mm-hmm.
living this, meeting people where they are physically and emotionally, in order to bring them along this
Love that.
fitness journey. And I guess the second part of your question is how I've created that and how it's impacted my happiness. I mean, I think my community is very much my students at the health and fitness center,
Mm-hmm.
the other moms at the soccer games who are doing everything they can to make sure their kids are physically active during
Mm-hmm.
this really sedentary, isolating time.
Mm-hmm.
So I do think that, as I said, we crave connection. So
Yes.
connecting with people who prioritize physical activity and really see the value
Yeah.
and benefit to their own physical and mental health and to others.
I love that. Those are great practical tips, connecting with existing communities already. Um, was there any certain phrase that you used to like reach out? Like, did you call? Did you email? Like, how did you build those communities or connections to existing organizations?
In terms of when I was working on the group exercise or for Move to Live More and connecting with communities, really to me it's, and I think my podcast really shows this. If I read about someone that I'm really excited about
Uh-huh.
what they're doing, I'll reach out to them. And if I'm talking with people who are doing really exciting things and they can recommend someone to me, so it's a way of connecting. I see my podcast as connecting thought leaders in
Mm-hmm.
healthcare, health and fitness
Yes.
and communities, and bringing them together and really knocking down the silos among
Mm-hmm.
those sectors. So if
Yes.
they're talking to each other, then we all can be expanding our worldview.
I
So I
love
think
that.
I think that living that connection, living that cross-sector collaboration, and
Yeah.
a lot of times I find that when we're looking for solutions to
Mm-hmm.
problems,
Yeah.
they exist. They
Mm-hmm.
exist, but we're not talking to each other. So we don't know ways to connect the dots. And
Yep.
so I talked with someone once who said, I'm a connector of people and ideas. And I thought, well, I aspire to that as well.
Yeah, and I think you're spot on with having a podcast, having a place for people to meet that are like-minded or even opposing ideas to challenge more thought processes and really make sure that we're on the right path. So I think that's a beautiful thing that you're doing with your podcast, and I'm excited to be a part of it as well. Um, Third pillar of Move Happy is movement related. Kind of the caveat, the background of it was started as a program I created in a psychiatric hospital with state funding. It's the last in the budgets to get checked off, so we had $0 for the budget. But I knew the power of movement, and I knew there was a ton of ways, like yourself, being a former group fitness instructor with limited budgets, how much we could do with our bodies without equipment. And so with that in mind, what are some of your favorite ways to move your body, either yourself or with your family, that don't cost a lot?
Yeah, I think affordability and accessibility is key for
Yeah.
getting people
Yeah.
moving. We need to remove those barriers.
Yeah.
And I've been lucky in being a group exercise instructor in that I've been able to take advantage of the services of the clubs where I teach. So that
Hmm.
is good for my budget. That's not available to
True.
others. But I found that I try to walk as much as possible and hike. I found the connection to nature has been
Hmm.
so important for my mental health
Hmm.
during
Hmm.
COVID.
Yeah.
My kids are all soccer players, and that's something that, and my husband's a coach on their teams, and we play in the town league, which is
Hmm.
very affordable. And we go out on weekends, and if they don't have games, we're at a local park
Hmm.
practicing.
Love it.
um, I wish that when I said, hey, we're all going hiking, they would all jump and scream in excitement. It's
Hmm.
it's hard sometimes to get them going, but that's been really important. And we all have we all have step monitors, so we challenge each other with
Ooh.
our steps. So
Mm-hmm.
going out just to get a walk in the neighborhood,
Uh-huh.
right? A family walk
I
has been,
love it.
yeah, has been good for both physical and mental health.
Yeah, I love that little fun family challenge too. That's great. What are you really, really excited about with Move to Live More that you'd like to share with our audience?
I'm excited about the possibility.
Mm-hmm.
And I think that for years, some of us have been talking about really the need to connect community-based health and fitness to
Mm-hmm.
healthcare,
Yes.
and not medicalizing fitness and not bringing it into the healthcare setting, but having trusted providers counsel their patients on physical activity and send them out into the community to work with others. I think social support is a
Yep.
really important, if
Mm-hmm.
you join a walking group or a
Yeah.
running group and get moving that way. So I'm excited about really, and I have to keep saying this, what is the silver lining in this devastating time when
Yeah.
so many people are suffering and struggling? And to me, I'm hoping that the silver lining is an increased awareness of health
Mm. Yes.
and an increased awareness of how infectious disease and chronic disease intersect,
Mm-hmm.
and how people if are at increased risk for infectious disease if they have one or more chronic diseases, and a real path forward
Mm-hmm.
to improved health as a nation, as a world. It's a global challenge.
Absolutely.
And so that is what I need to keep reminding myself of.
Absolutely. And you're doing such great work. I know we've got listeners that are dying to connect with you. What's the best way that they can do that?
Yeah, so I have my website, movetolivemore.com, and I have all my podcasts on there where I bring these thought leaders that I mentioned
Mm-hmm.
together to
Mm-hmm.
talk about innovative ideas for addressing the problems we've talked about: chronic disease and
Yeah.
obesity and physical inactivity. I also do a blog series that's on my website as well that
Mm-hmm.
works to translate research on the connection between COVID and physical inactivity and obesity.
Mm-hmm.
And I also do a blog series on, I mentioned, physicians counseling patients and working to get them more physically
Uh-huh.
active. And then I'm on Twitter, I'm on LinkedIn, I'm on Instagram at Move to Live More.
Love it. So everybody needs to follow you right now on all social media channels. They need to go straight to your website if they are a physician or patient wanting some more information on how to live more and hire you for services. Last but not least, I always love to close out the show with a funky, fun question just to kind of keep things fresh and happy. Um, so I know we didn't talk about this before, but since you mentioned having your kids, where is a place when COVID is done and we're able to like move about safely and whatnot? Where's a place that you'd like to go with your kids that you haven't been yet?
That is easy to answer.
Ooh.
So my husband and I met at a Japanese class in Boston. We both
Ooh.
have studied Japanese for half our lives. And so we had planned
Wow.
to take our whole family to the Olympics in Tokyo.
Oh my gosh, that's so cool.
And the Olympics obviously were
Yep, it's on pause.
postponed.
Yep,
So we
yep.
have all our tickets and our plane
Mm-hmm.
tickets,
Mm-hmm.
and
Mm-hmm.
we are really hoping that we get to go next year. The kids
Yes.
just sort of transfer over a year. We
Mm-hmm.
have the schedule. And so it was really a way for us to introduce our kids to the country that we love so much.
I love that. That is so amazing. And fun fact, my Move Happy program was facilitated with my colleague who's from Japan, who brought a lot of her holistic practices and mindfulness-based meditation. So really excited to hear that about your passion. Lots of synergy we've got. It's been so fun.
Absolutely.
So
We
fun having you
do.
on the show. Thank you.
Right. And yeah, not just the names of our organizations, but the synergies go deeper and further
Yeah.
back. So
Yes.
Erin, thank you so much for having me
Absolutely.
on.
Absolutely. Would definitely love to have you back on a follow-up session. We'll keep in touch throughout.
Thanks, Erin. I appreciate it.